I'm Dr. Kiko Glasgow, and I'm going to be talking to you today about the cause of acne, the basic cause of acne, and how to treat it. So I've made here a little basic diagram of the skin. So most people have probably seen a diagram like this. This is the very top layer of the skin, the epidermis. Next down is the dermis. Obviously this here is a pore, and associated with that pore is an oil gland. Okay, so let me tell you a couple things about the normal skin, and then we'll kind of understand about how things go wrong and cause acne. So one of the first thing that you need to know about is that this layer between the epidermis and the dermis are these little cells that are right here at this little wavy layer between them. And these cells are basically a stem cell of the skin. They eventually turn into an epidermal cell, and as they mature, they make their way to the top of the skin. Eventually those cells lose their nucleus and fall off as a little dead skin flake. In normal skin, we're always constantly exfoliating our skin and losing those little dead skin flakes. So that's normal. Another thing that happens is that as we go through puberty, under the influence of hormones, the very small oil glands associated with the pore get larger, and under normal circumstances, the oil comes out and goes up the pore and moisturizes the top of the skin. So those are normal things. Now in terms of things that go wrong in acne, one of the things that of course does contribute to acne is that increase in oil. That's why you don't see 5-year-olds walking around with acne. So what seems to go wrong in acne is these dead skin flakes, we call them the stratum corneum, those dead skin flakes become very sticky. And you can see up here, that's one thing you can do. You can exfoliate. That's why people always talk about exfoliating acne. But the problem is that the epidermis wraps around the top of the pore, and so these little cells that are going this way have to come out and go into this area. And this is where the problem happens. You could buff puff yourself raw, but what's going to happen is that the exfoliation doesn't reach down that deep, and so you start to get a buildup of dead skin cells right here. When you get this mixture of dead skin and oil, it can form a plug. We call that plug a comedone. People call that a blackhead or a whitehead, same thing, but that's the comedone. And you can kind of picture two things that are going to happen when you have a plug there. One thing that can happen, it's sort of like the faucet's on, but the drain is plugged. And for some people what happens is there starts to be a big buildup where the oil sort of gets backed up. And sometimes it'll feel like a deep bump underneath your skin. It can be very tempting to squeeze that bump, but that would be the wrong thing. Sometimes it can get so big that actually the oil starts to come out into the dermis, and your skin will not be happy with that because the oil is out of place. So that's one thing that can happen, is the plug can cause the oil to back up. The other thing that can happen is we normally have a few resident bacteria out here sitting on the skin. It's so common they actually call it normal flora. And when you have, they're normally pretty sparse, but if you throw the equivalent of a big picnic of dead skin and oil, you're going to get a bunch more bacteria in here. It's sort of like you're feeding them extra. So you'll have a big buildup in the number of bacteria that are in that pore. Hang on a second, there we go. Now, your skin has immune cells that are roving around. They're always on the lookout for viruses, bacteria, and other things that aren't supposed to be there. And when it sees a big buildup of bacteria here, those cells are going to rush in there. When they do, they release little cytokines, chemicals called cytokines, and those chemicals that release make the area red and hot and tender, and that's when you get that big juicy pimple there. That's because those chemicals being released cause inflammation. Okay, I'm just going to write inflam there. I can't squeeze it in. So what you see here is basically what's going to happen in acne. If you see how this is all starting, you realize that there's one thing you could do to stop it, and that would be to get rid of the comedone. If you could get rid of this comedone, you might be a little shiny and oily looking, but at least there would be the free flow of the oil. There wouldn't be the increase in bacteria, and therefore there wouldn't be the increase in inflammation. So the main thing you want to do is get rid of the comedone. Well, how do you do that? There's two types of ways to do that. The first one I would say that's most important is use a medicine that's based on vitamin A. You can either put it on top of your skin, and that would be things like retinoids, like tretinoin, adapalene, other things you can put on your skin. The other way is take it as a pill, and that would be Accutane. So that would be for a stronger version. What that vitamin A will do is prevent the dead skin cells from being sticky, and therefore you won't get the buildup of that comedone. It'll also actually somewhat decrease the oil. But anyway, that's the most important thing. So you want to be able to prevent this comedone. So when a dermatologist examines your skin, they're going to feel all of your skin for little bumps, those whiteheads and blackheads. Those aren't a pimple today, but they're going to go on to become a pimple. So the way to use the topical vitamin A products, or the retinoids, is you're going to take a small pea-sized amount after you've washed your face at night, make little sesame seed-sized dots all over your face, everywhere you could possibly get a pimple, rub it in, and that's going to prevent you from getting the comedones. It's not a spot treatment for acne that you already have. By the time it's already a big juicy pimple, it's sort of too late for that. But if you use the vitamin A products regularly over the months, you'll have fewer and fewer comedones, and you'll be less likely to get pimples in the future.